Well, there's a lot of conversation and a lot of confusion, unfortunately, around childhood vaccinations. Research showing that childhood vaccination numbers in the Garden State are actually down. And joining us this morning is Margaret Quinn, who is a doctor of nursing practice and clinical professor in the School of Nursing at Rutgers University, to help break it all down. We say good morning to you, Dr. Quinn.
Good morning, Mr. Rosato. How are you this morning?
Very good, doctor. Thank you. And I know that with the numbers of vaccines down, of vaccinations down, we also are seeing spikes in things like measles, et cetera. Whether there's a direct link, or it could be because certain religious communities don't want to get the vaccine, et cetera, and they're growing in number. That's neither here nor there. The problem is it's a public health concern.
Correct. We're very concerned about what's going on right now. When the year started, the Health and Human Services Division and the Centers for Disease Control came out and said that they were changing some of the vaccines from being required to recommended. And that sent some confusion around the providers like myself as a pediatric nurse practitioner, as well as our physician colleagues, as to exactly what do we tell our families and our parents. And that it's really been a lot to unpack as we've been watching this change just about every day. Just the other day, they came out with different suggestions, and now we're learning that over 28 states are not agreeing with the new recommendations. In our area, New York, New Jersey, Connecticut, Pennsylvania, we are not following what the HHS is saying. So it's making some confusion for parents, for schools, for providers, and it is concerning when we see what's happening in, say, South Carolina with the measles. Very concerning. We don't want that to happen again here in our area. So we do have to keep our families educated, and we need to keep the lines of communication open.
Yeah, and just for clarity's sake, states have the right to superimpose their own rules on things like this. So that's always been the case for medicine and things like that. It's usually the federal government usually gets itchy about it if it's the opposite. If the federal government is telling you you must take a vaccine and the state says we won't, that's when it becomes a bigger like argument, because then the states around saying, hey, how are you need to do it. New Jersey and New York and Connecticut asking or saying, not asking, requiring that the parents make sure those kids do still get all the vaccines. The federal government's like, do what you want to do. Because what they're trying to say is want to leave it more in the hands of the states and the parents. And what the federal government has said is they're trying to align more with Europe, because Europe requires fewer vaccines as well. So they're trying to line it up, but they're not saying don't get the vaccines. I want to make it clear, but I think that's their fault for not clarifying that. The federal government never said do not get the vaccines. They're simply saying talk to your provider. It's up to the state. It's up to you and your provider. But I think that needs to be driven home more.
Exactly. And it's also adding a level of confusion, right? Because if we're saying here in New Jersey, you need to get these vaccines for school, we now have parents saying, yeah, but the federal government saying we don't need them. So that's adding an extra layer of confusion, even going in the opposite direction, like you were just talking about. So that's where this is adding some confusion. And we really need to be talking to our parents about this.
Yeah, and it is there's no reason for the confusion. It could have just been taken care of a little more carefully with better explanation. I mean, even if Dr. Oz had said something along the lines of, and far be it from me, I'm not a medical professional, but if he had said something like, "Listen, we're not telling you not to get this. We're saying just if you want to keep doing what you're doing, that's fine. We're just telling you we're not going to mandate it from this end." If it was something as simple as that, I think that would have cleared things up so much more. Is it me?
Mandates, suggestions, recommendations, requirements, all the words can be used interchangeably, and that's what's making this so confusing.
Yeah. Yeah. And bottom line is this, look, if you're there is it's only anecdotal evidence that has been disproven and debunked many times over about vaccines causing issues. There is no
Mhm.
concrete evidence and concrete proof. I think as a medical practitioner yourself, a nurse practitioner, and by the way, just so that people don't get confused, doctor of nursing, you that means that you can teach nursing, right? You can at the university level, you can teach and certify other nurses. But you're not an MD, but you're an NP, a nurse practitioner. So I want to make sure everybody gets it, only because I have I have PAs and NPs in my family, and I always want to make sure that everyone understands the title. But yet you are still doctor because you have a doctor in nursing. So I know that I probably just confuse things even more. What
All good.
vaccines? Well, but yeah, just so you know, I get it. What vaccines would you say are, what are the ones that right now the federal government kind of pulled back on that you're saying that we really still should make sure the kids are getting? Is measles among them?
No, measles is still definitely required for all 50 states, and all the states are agreeing with that. The ones they took away are hepatitis, they didn't take away, but they're not requiring anymore, are hepatitis
Yeah.
A and B, which is
Yeah.
concerning. The new RSV vaccine, as well as the meningitis vaccines. Now, those are vaccines that we give our teenagers, meningitis A and B. We give those to our teenagers. They are at the highest risk for getting meningitis. And now they're making those a recommended, not required. And that is so concerning. I've taken care of children with meningitis. I've taken care of children that have passed from meningitis,
Yeah.
all very, very scary. So, again, in New Jersey, we are still requiring it for middle school and high school, and even some colleges require both meningitis A and B. So that'll be changing over time. RSV, I know
And
you've had.
meningitis. Yeah. I don't mean to cut you off, doctor. We're down to 10 seconds. Meningitis, very painful, awful thing for a kid to get. Just give them the vaccine, for God's sake.
Yes.
We need to have you back on, especially with this bad weather. Margaret Quinn, doctor of nursing practice and clinical professor in the School of Nursing at Rutgers University. We appreciate you. Thank you for what you do as well. And thanks for coming on this morning, doctor.
Thank you.